Cuba faces a severe economic and humanitarian crisis driven by a U.S. fuel blockade and political tensions. But its medical ties with Jamaica continue as hundreds of students remain in the country to further their studies. Romardo Lyons has that story.
Months ago, Cuba and Jamaica made headlines almost everywhere. The topic? Healthcare. A 5-decade-long medical program in its form then ended, but the ties between both countries continue to bear medical fruits.
We all continue to value the significant contribution that Cuban medical professionals have made to our health sector over many years.
A batch of Jamaican students in Cuba have completed medical studies for the 2025-2026 academic year. 5 are on Jamaican government scholarships. Hundreds remain.
So close to 270 remain in Cuba, to the best of our knowledge, of whom 40 are sponsored by the government. That is, they're on Government of Cuba scholarships, which are supported by the Government of Jamaica. Since our last update, one student, a private student, has formally advised of his return home. 3 others have indicated that they're in the process of continuing their studies elsewhere through academic transfer.
The minister indicated that others have already returned to Jamaica without informing the government as they were studying privately. Nonetheless, she reasoned that the government has set up clear lines of communication and renders assistance to those wanting to return. This as there's close watch on the situation in Cuba. International groups have called it a severe economic and humanitarian crisis.
Our concern remains for their safety, well-being, and academic continuity. We know that prolonged power cuts and reduced public transportation causes challenges for their way of life. And the government has communicated our preparedness to assist with one-way return tickets should they wish to return but have a difficulty with affordability. And we continue to engage the Ministry of Education, the Ministry of Finance, and the Ministry of Health, as well as medical tertiary institutions on what, if anything, can be done for those who may wish to return and continue their studies here.
In the meantime, life has been pumped back into the medical program as it now operates under different guidelines.
A number of Cuban medical professionals chose to remain in Jamaica and continue to work under individual, that is personal contracts. Others who had left have since returned and again are working here under individual contracts.
Romardo Lyons, TVJ News.